Wegovy and Zepbound carry boxed warnings, the strongest label warnings, for tumors in thyroid cells called C cells. This warning concerns one cell type, not all types of thyroid cancer. Rodent studies triggered the warning after C cell tumors appeared with stimulation of glucagon-like peptide 1. Trials show no clear overall cancer increase, although a 2025 analysis found more thyroid and colorectal cancers in treatment groups. The boxed warning focuses on medullary thyroid cancer, which begins in those C cells. Papillary thyroid cancer, the most common thyroid cancer, starts in different thyroid cells. Wegovy and Zepbound should not be used with a personal or family history of medullary thyroid cancer. They should also be avoided with multiple endocrine neoplasia type 2, an inherited condition that can cause tumors in hormone glands. That distinction matters because a relative with an ordinary thyroid nodule does not create the same restriction. A family history of papillary thyroid cancer is also different from medullary thyroid cancer. When someone says thyroid cancer runs in the family, the exact cancer diagnosis can change the medication decision. The warning also does not call for routine thyroid ultrasound or repeated calcitonin testing in every patient. Calcitonin is a hormone made by C cells. Routine testing can uncover unclear findings that lead to more scans or biopsies. Human trials provide the clearest evidence about cancer overall. Randomized trials compare groups that are made similar by chance at the start. The 2025 analysis mentioned earlier included 50 trials lasting at least 1 year. Overall cancer rates were similar between treatment and comparison groups. The analysis also found more thyroid cancers in treatment groups, but the total number was small. With so few cases, each additional case can change the results substantially. That small case count limits the thyroid finding. Large patient databases provide another view. A Scandinavian study followed more than 145,000 users of these medicines for 3.9 years on average. Very few medullary thyroid cancer cases occurred. Overall, the study found similar thyroid cancer rates in the groups it compared. Not every database study agrees. A French study previously reported more thyroid cancer among users of these medicines, especially after 1 to 3 years. Database studies can be affected by differences in obesity, diabetes severity, screening, and medical visits. More neck imaging can also uncover cancers that were already present. Randomized trials and databases can point in different directions. Assigning people to groups by chance reduces many differences between them, but cancer events are rare and trial follow-up is relatively short. Databases contain far more people, but baseline differences between treatment groups are a major source of bias in cancer comparisons. Drug safety reports add a third source of information. Patients and clinicians can report cancers diagnosed after a medicine was used. These reports cannot tell whether cancer is more common in users because they do not track a similar group of non-users. Their main value is helping regulators spot unusual health problems reported after treatment. Time remains the biggest limitation across all three sources. Cancer can take years to develop or become detectable. Most obesity drug trials last months to a few years, not decades. Current human evidence is better at detecting a large short-term danger than a very small delayed effect. Pancreatic cancer is another common concern because these drugs have warnings about pancreatitis, meaning inflammation of the pancreas. Pancreatitis and pancreatic cancer are different conditions. So far, larger human studies have not shown a clear increase in pancreatic cancer with these medicines. The current pancreatic cancer data are reassuring. Colorectal cancer is less settled. A 2025 review of randomized trials found a small increase in colorectal cancer in treatment groups. The increase appeared mainly in shorter trials. Many cancers take years to develop, so increases in short trials are harder to link to treatment. Longer trials are needed to explain why results differ. Other analyses reported no increase or lower colorectal cancer rates. Researchers have also examined breast, prostate, liver, kidney, ovarian, and uterine cancers. Randomized trials have not shown a clear increase in these cancers. Some database studies report lower rates for several obesity-related cancers, particularly when these medicines are compared with insulin. The comparison drug can change the apparent result. People using insulin may have had diabetes longer and may differ in weight, kidney disease, or other cancer risks. People taking metformin, a common diabetes pill, may have had diabetes for less time. Cancer comparisons depend heavily on which treatment is used as the comparison group. Weight loss adds another factor. Excess body fat is associated with several cancers through hormone changes, poor response to insulin, and long-lasting inflammation. Sustained weight loss may reduce some of those harmful changes. Cancer prevention is not an established benefit or reason to prescribe these drugs. For an individual patient, the first concern is confirmed medullary thyroid cancer or multiple endocrine neoplasia type 2. Do you or a family member have either condition? If yes, Wegovy and Zepbound should not be used. An ordinary thyroid nodule, low thyroid function, or a family history of papillary thyroid cancer is a different issue. Second, is there an active cancer or a previous cancer diagnosis? Most previous cancers are not listed as automatic reasons to avoid Wegovy or Zepbound. Cancer treatment, surgery, poor intake, vomiting, or dehydration are reasons to coordinate care with a cancer specialist before intentional weight loss continues. Third, is routine cancer screening up to date? These medications do not replace colon screening, mammograms, cervical screening, or lung screening when you qualify. The thyroid warning does not justify whole body scans, blood tests marketed to detect many cancers, or repeated thyroid imaging without a reason. Symptoms should be evaluated according to what they suggest. A new neck lump, persistent hoarseness, trouble swallowing, or unexplained shortness of breath deserves assessment because those symptoms appear in the thyroid warning. A thyroid nodule found on examination or imaging also deserves the usual thyroid evaluation. Other persistent symptoms need the same targeted approach. Examples include ongoing abdominal pain, yellow skin, blood in the stool, or unexplained bleeding. Continued weight loss despite dose reduction and improved eating also deserves review. Medication-related nausea should not become an explanation for every new symptom. Immediate symptoms can be evaluated now, but long-term cancer risk requires time. Most human studies cover months to several years, not decades. These drugs are avoided in people with the high-risk thyroid conditions described earlier. Human evidence therefore comes mainly from patients without those conditions. Keep standard cancer screening on schedule, investigate meaningful symptoms, and update the prescriber when personal or family cancer history changes. Routine calcitonin testing or repeated thyroid ultrasound should not be added solely because a patient uses Wegovy or Zepbound. The thyroid warning is specific. Human trials have not shown a clear overall increase in cancer, while thyroid and colorectal cancer results still need longer follow-up. Large database studies have produced mixed thyroid results, so all the evidence together matters more than any single study. Wegovy or Zepbound should therefore be judged against the patient's obesity risks, expected benefits, reasons to avoid treatment, and cancer history. The decision is not cancer risk versus no cancer risk. It is whether the known benefits outweigh the known harms and the remaining uncertainty for that specific patient. Medicine Simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.